Welcome to my podcast. Today I'm going to talk about another case station for the interview for the applicant who applied for School of Medicine in Liverpool. So the theme today is about ethic, and the station steams around big heart transplantation. So the first question to ask, can you give me two potential outcomes from using big hearts for transplantation to a human, and give justification. And also you need to give two potential negative outcomes with justification and any additional two ethical consideration that might arise from using genetically modified big organs for human transplantation, and you need to justify as well. So I came across diverse and different candidates. Some they did quite well and managed to do this in time, effectively and efficiently, and some they struggled. And I felt the kind of questions sometimes can be confusing because some of the candidates they kept mixing and going back and forth between two, though I didn't ask the second, and some they jumped into the genetically modified big organs. So let's go about the positive outcomes which I come across, could make sense in a way. So say for instance, some they stated about the instant shortage of the organ donation because there's the system here opt-in and opt-out, and comparatively to the US, it's opt-in. And the healthcare system there is not free as in the UK, so it's quite expensive. And they mentioned about the shortage of the organs from a human who was donating, and also the backlog and the waiting quite lengthy. And also it could be something alleviating for some people because the positive outcome, so it's going to shorten this the long wait, and human they will get that heart transplanted for whatever condition they had, and there might be better quality of life. However, some candidates they mentioned it was controversial. And also it will alleviate human suffering, of course, and prolong their life. And it could also, because we know that a lot of patients, they might have problems that could die off. So this idea of peg heart transplantation could solve that problem. And of course, the genetically modified pig could provide abundant and reliable source for organ transplantation. And the justification for this kind of thing that pigs are bred for medical purposes, and their organ anatomically similar in a way, size-wise, and to the functionality to human organ. And of course, the idea of genetic modifying to reduce the immune rejection and will save more lives. And maybe with the future advancement, there will be possibly pig to human transplant process, which could drive, of course, significant advancement in immunology and transplantation, and would benefit advancement in the medical field. So the negative outcomes, it could be, of course, rejection. However, we mentioned about the big genetically modified would lessen risk of that. However, we can't guarantee this. And the xenotransplantation could, of course, cause cross-infection from certain species, and also the compatibility, blood and tissue-wise, which, of course, another thing to think of. And the idea of course, immunosuppression for the organ to be not rejected could cause also other problems to the human being. So their lifelong or lifespan may be shortened because of the vulnerability to certain other infection. Because we know that if someone is taking immunosuppressant, they're going to take it for long, and they might take it for life, like steroid and other immunosuppressant. So all of that will act on the immunity, and of course, the immunity won't be as it was before, so it will be modified, and this could, of course, affect the quality of life. And apart from that, also, if there is any latent virus that's present in the pig, it could be transferred. Also, some they mention about the pig that they are unhygienic and clean, and they're wild, so that's another thing to think of. And of course, the ethical dilemma and the social concern. It could be, of course, there's different opinion in regard. So the moral implication could be diverse, because in certain culture and in certain religion, there is no belief of such a thing. And also, there is the issue about the animal, that's the animal welfare is affected, and it would be like a waste. Once you take the heart, what you're going to do with the rest of the body? So it will be like a waste, and like you are expoliating the animals in a state that they can't talk for themselves, if they're going to accept it or not. And of course, certain, also even if it's not religious, they might be reluctant. They wouldn't feel like, oh, they want like an animal thing inside their body. So the kind of thing is kind of complicated, and it could be debatable, and it's not as easy, straightforward answer. And also the idea of certain people, they might be vegan, like we know in certain cultures they don't accept the blood, like Jehovah's Witness. So there might be people who are vegan, so they don't want anything to do with animals, so that's another thing. And of course, the suffering of the animal, who's gonna take their heart, so the animal welfare issue will be considered. And the other ethical dilemma that we need to consider, it's like playing with God and playing with nature order. So by modifying the big genetic transformation for the human needs, it could be perceived it's playing with God development, and this will disrupt the nature of life. And also, we don't know a lot about the long-term implication of this, because the knowledge is still limited in that regard, and we don't know so far what might happen, like a lot of pharmaceutical drugs nowadays, which has been issued for certain diseases as it's a revolutionary thing, but we don't know about long-term consequences. So that's another thing. It might raise the concern about the four elements of the ethics, and therefore, whenever it comes into those kind of things, you need to talk to the patient in an open and transparent way, and let them know what's around this area, and weigh, of course, the benefit and the risk, and let them decide if they're gonna go with that. Because even if the patient went for that kind of operation, which can be lengthy and complicated, and if it's not, for instance, meant to be a success, this will cause, of course, waste to the surgery, waste to the organ, waste to the life, and waste to the patient, waste to the resources, waste to the fund. All of that will be implied in that kind of thing. And of course, some of the candidates, they state that this will minimize the long wait, and it's a cheap way because it's a pig. On some they say no, it's quite expensive because this will involve a lot of things. So there's discrepancy between both sides. And of course, as I mentioned, it's kind of a kind of debatable issue. Some they favor, some they wouldn't, and of course we can't tell because from the doctor's side of view, the doctor wouldn't feel for the patient, doesn't know what it means like to have this kind of things. And of course, the science will just want to advance in one area, trying to persuade or imply that this is a major success or revolution or innovation, but we don't know, of course, because it's all liable for pros and cons, and medicine, of course, it's changing across the time. So we need to be very frank to patient and tell them about what could happen and how it could happen and what we can do, and give them the choices in order to understand the whole story. Because you can't just say, oh, this we have a heart for you from an animal, this will prolong your life, and just leave them like this. It can be delusional, and the patient might not understand the whole picture because they just felt like they're desperate for something, but they don't know about the whole thing. And as we all know, the first xenotransplant happened in a living person was in 2022 in a person who was 57 years old, and he only survived for 6 days after the procedures. And the other person was 2023, who only survived less than that by 20 days. So we can see it's not straightforward, and the whole process is not straightforward procedure, it's not easy. And the idea of that peg, in a way, they have the same heart size of a human. It can't be just like that. Another harshness they spoke about, that the pig are put in confinement in a controlled condition, so that's another harshness for the animal, and could just affect their well-being and their welfare. So so we couldn't tell exactly how this will help in the long run. And of course, when we need to think about the four elements of the ethic, we need to think about not doing harm, both sides. So we need to think for the best interest and what we can gain with that, and how to improve survival state forever condition, because we know sometimes those person who had the heart transplant might have another alignment or other medical conditions which had failed this heart. So we need to put in consideration also those things to know if this will help in a way, because we can't compare it, for instance, to kidney transplant or patient on dialysis, because heart is a quite major thing and it might involve also with the lungs. So we need to think thoroughly in terms of pros and cons, and weigh things between the benefit and risks, and see what we can do. And it's still a new thing, of course. We don't know about the whole thing, but it can be ambiguous as well. And there might be new thing, different avenue. It's quite a controversial scenario. So you need to also respect patient wishes. If they say no, it means it's a no. Try to find another solution or what can be done, not just to push them because, oh, this is something maybe new, you want to try it and make the patient feel like, oh, this is the only thing they still have. I remember once I was like shadowing before I started working. a doctor, he just said something I felt like it's misleading, to be honest. He said to the patient, your system is not working now, we need to get it up and running, and the patient didn't understand this word, because we need to be very thoroughly, very open, very transparent, in order for the patient not to come and feel sorry or blame, because this is a very critical situation. And also, getting a heart from an animal, it means like slaughtering that pig or killing that pig. So it's another thing. It's gonna fall with the 4 element, of course, of the ethic. And so it's just important that we need to be like, because we know before, for human to human transplantation, it's kind of different, and it involves certain situation like patient is brain dead, or had brain injury, or RTA. So that's another thing. So it could be, as I say, in certain ways they're gonna think this is unethical and can't reflect, obviously, humanity. And also some they said, like for instance, there is structural difference between a human and pig, and they are less metabolic and not adaptable, and there's risk, of course, of infection. So, as I say, it's quite very complicated thing, and it will involve a lot of things to be done before deciding to go ahead. And even though you go ahead, it might have the risks. So it's always we need to see what this will achieve, how far we need to achieve, and is it doable or not. We can just try. And because some of the candidates mentioned that it's a play of God, so it's like you're playing against nature and it can't work. And a long time ago, like this one, the dolly sheep, which has been genetically modified, as I recall, for the IVF, and I believe the sheep passed away. So it's just, you need to be scientifically proven, you need to be sincere, you need to be truthful to the patient and let the patient decide if they're really desperate to have this, or maybe they're really liking the whole thing. Because some people, they might not. One of the candidates, she seemed to be very, very excited about the whole thing. It felt like, oh, she's gonna go for it, even if she needed. And some they say no. So there's diverse perception about the whole thing, and of course, as I say, you need just to be truthful, open, sincere, and explain everything thoroughly in order for the patient to decide what could work for them. And of course, don't forget about the lab thing, which will be needed as well. I hope by that I just covered one of the main things that will spiral the 4 elements of ethic around it. And I see you in another podcast. Thank you.